Hello everyone. In this session, we are going to see about the behavioral pain assessment scale, which is done in cardiology ICCU for a non-ventilated who is comatose or might be in deep sedation, or as well those patients who are ventilated who are not able to give the commands or response to our talk. For those patients, we can use this behavioral pain assessment scale. So this scale we call it as BPS scale. So the focused area in this assessment, it includes three major parts. One is the facial status of the patient we are going to analyze, and then because the patient may be in deep sedation, in coma, or might be in case of severe ventilated, such as might be through tracheostomy or through the endotracheal tube. So mostly if the patient is comatose, we go in for the assessment that has the GCS scale, Glasgow Coma scale. So here, this scale will aid in how deep is the patient in the level of agony, that is the pain. So the three major things which we are going to focus in this assessment is the facial status of the patient, the movement of the upper extremities, as well as the response in case of non-intubated or patient under mechanical ventilation, how they are moaning. So these three will be the focus assessment in the behavioral pain assessment scale. So this is a sort of a scale which is usually done in the hospital setup for patients who are intubated as well as for those patients who are not intubated. So as I told you earlier, it is going to cover the three major aspects, that is the facial expression, then the movement of the upper extremities, as well as the vocalization to pain or the compliance with the ventilation. So in this, we will be seeing the facial expression, and if there is no expression in the face, we are going to give a score of 1, or otherwise we can call that the patient is totally in a relaxed position. In case if the patient is showing some eyebrows being lowering, or it is going upward, or tightening of the eyebrows partially, it shows that patient is going to have a score of 2. And in case of like fully tightening of the eyebrows and the eyelids tightly closed, then the patient will get a score point of 3. And in case where the patient is having grimacing with folded cheeks, which shows that the patient is in severe intolerable pain, then the patient is going to get a score of 4 in facial expression. And then followed by that, we will be checking the movement of the upper extremity. If there is no movement, then the patient is going to get a score of 1. If the patient shows some sort of partial bend or some sort of flexion, which shows that the patient will get a score of 2. If the patient is going to have bending of the arm along with finger flexion, then the score goes raised a little higher, that is 3. And in case if the hands are totally retracted opposition to the calf, then that shows that the patient is in severe agony pain, which patient is going to have a score rate of 4. And the last comes the compliance with ventilation in case if it is a mechanically ventilated or intubated patient. So well tolerating the ventilation, there is no troubleshooting, there is no non-compliance with the ventilation, then the patient will get a score of 1. In case if the patient is coughing and somewhat tolerating the ventilation, then the patient gets a score of 2. In case if the patient is fighting along with the ventilation settings, unable to go for the synchronization, then the patient will get a score of 3. In case if the patient is unable to control the total ventilation, then the score rate raises around 4 in case of a mechanically ventilated patient. On the other hand, the facial expression and the movement of the upper extremities are the same, but only the third thing, that is compliance with the ventilation, is totally changing to vocalization. So no pain of vocalization, so patient gets a score of 1. Moaning frequently, so patient is getting a score moaning but not frequently, patient gets a score of 2. Moaning very frequently, patient gets a score of 3. And might be howling or like complaining about the deep agony pain, the patient gets a score of 4. So with these 3 parameters, we will be calculating 1, 2 and 3, and the total score will be given. So the scoring range is from 3 to 12. 3 is the minimal range where 12 is the maximum. So with this we will identify whether they are in the mild, moderate or severe sort of intolerable pain. So how long are we going to perform this one? Yes, it's going to be done around a minute to assess the behavior, and this to be done without any further stimulation to the patient. So how do we interpret? Yes, the scale ranks as I told you earlier. It is ranking from 3 to 12, but 0 to 3 indicates that the patient is in either very mild pain or painless pain. And 4 to 6 gets a score of mild pain, 7 to 9 moderate pain, and 10 to 12 where it is very intolerable pain. So some of the following important considerations is that this BPS should be done very frequently on the patient among ventilated as well as non-ventilated patient to know how far or how accurate we are scoring on the patient. And then we have to use to the appropriate patients such as critically ill, who are sedated, who cannot communicate or who are under intubation. So those patients can be assessed the level of pain by using BPS. As well, when we are going to interpret the BPS score, we need to clinically correlate the patient vital signs, the patient's behavior, as well as the situation. And the last one to be kept in mind is that regular assessment must be done before and after all the painful procedures to monitor the pain levels and as well as to adjust the pain management accordingly to the patient in case if they are in sedation or if they are in case of agony or might be if they are in the case of patients who are having severe intolerable pain who are unable to communicate with us. So this on those bases we have to do the regular assessment irrespective of the shift basis we go and communicate with the patients. And that's for today. Hope you all enjoy the video. And if you have any further queries or any suggestions, please don't forget to put it on the comment box. And please stay tuned for further assessment on the hepatojugular reflex, which is going to be the following video. And thank you for watching. Thank you once again.